IMTEC Corporation, specializing in research, design, and development of new dental technologies, is proud to introduce a powerful addition to the field of dental implants, a small wonder. The Sendax Mini Dental Implant System. As we enter the 21st century, minimally invasive devices and procedures are now the fastest growing segment of the medical device industry. Compared with traditional approaches, they reduce risk to the patient, require less anesthesia, shorter surgical and recovery times, and result in significant cost savings for you and your patients. IMTEC's mini implant system is a unique procedure designed as an alternative for those patients who can benefit from recent advances in dental implant technology, but can neither tolerate conventional implant surgery nor afford its typical restoration. The system utilizes a 1.8 millimeter diameter surface-etched titanium alloy screw implant and prosthetic abutment. After a minimally invasive 5-step surgical protocol, the mini implant can be immediately loaded. This makes it well suited for ongoing stabilization of a prosthesis or transitional support of a prosthesis during the no-load or progressive load healing period of a conventional implant system. Perhaps its most important application is for the immediate and ongoing stabilization of a lower denture. We'd like to demonstrate this 5-step procedure for you through the use of animation, hands-on display, and highlights selected from a recent mandibular overdenture surgery. After patient selection and evaluation protocols have been completed, the number of Sendax mini implants required is determined with the procedure thoroughly discussed with the patient. Mini implants should be placed no closer than 5 to 8 millimeters apart. The clinician should palpate the labiolingual or buccolingual width dimensions to estimate the optimal direction and angulation for implant placement. Bone calipers may also be used to estimate actual bony width once crestal soft tissue anesthesia is obtained. Cross-sectional CT scan reformatted images can be a useful supplement, but clearly are not essential for most simple estimation purposes. A point probe may help estimate soft tissue depth and quality of the underlying bone. Step 1 is to create minimal pilot holes directly through the attached gingiva and cortical plate to provide a starting point and directional guidance. Entry points for each mini implant are marked on the patient's tissue via bleeding points or a marker pen. An IMTEC pilot drill is placed over the entry point and lightly pumped up and down through the crestal soft tissue, then the cortical bone layer, until it is 4 to 5 millimeters into the underlying medullary bone. Sterile irrigation is utilized throughout the drilling procedure. The desired depth in bone is approximately 1/3 of the threaded length of the implant. This completes the simplified minimally invasive drilling phase. Excessive drilling force is never recommended or required by this protocol. The proprietary thread design of the system will permit steady mini implant auto-advancement, self-tapping in all bone types, with the possible exception of the densest type 1 bone quality. In such cases, it is better to avoid burnishing or stripping of hard bone by not over-drilling and to simply settle for a shorter, well-integrated implant. Step 2 is the implant insertion procedure. Separate the sterile implant from the plastic cap and housing by squeezing the neck of the cap, thereby removing it. Next, attach the titanium finger driver to the head of the implant. It has a friction grip and can be used as a carrier to the patient's mouth, as well as a beginning surgical driver. After inserting the implant into the pilot opening through the attached gingiva, rotate clockwise while exerting downward pressure. The procedure initiates the self-tapping process and is used until noticeable bony resistance is encountered. Step 3 utilizes the IMTEC's winged thumb wrench. It is designed to deliver a greater amount of torque. Use it to thread the implant into place until the wrench becomes difficult to turn. It should be noted here that if no significant resistance is met during this mid-stage of insertion, the prognosis for the implant reaching its fully integrated potential is doubtful. The patient's bone at this site lacks the required density for predictable success, or the bone was over-instrumented. Remember, a self-tapping protocol is required for this system. The implant bites into the bone and advances itself from that initial point to completion. The procedure demands torquing forces that progress from finger to thumb screw to ratchet wrench. Step 4 accomplishes final seating of the implant. Remove the winged thumb wrench. Grasp the ratchet wrench with the directional arrow facing clockwise. Then, insert the ball and O-ring of the ratchet wrench adapter into the bottom of the opening of the wrench. The final stage of mini implant placement requires small, incremental, carefully controlled ratchet turns for permanent seating. The ideal length allows the abutment head to protrude from the gingival soft tissue at its full length, but with no neck or thread portions visible. It is important to note that the unique proprietary thread design of IMTEC Sendax system will impart to the inserting procedure a proprioceptive finger sense that the mini implant is being virtually drawn into the bone as hand wrenches and ratchet are applied to auto-advance the implant to its fully seated final position. The implant can then be ratcheted until it demonstrates a rock-like integration, which will then allow it to be immediately loaded for function. It is also important to remember that when instances of very dense bone are encountered, the clinician should be alert to watch for ever-increasing resistance to the clockwise turn. When significant resistance is encountered, the turning pressure should be reduced with short spaces of time between turns to allow the bone to adjust. You are now ready for the 5th step, intraoral retrofitting of a lower denture using the O-ball abutment and mini keeper cap. Transfer the position of the abutments to the tissue-bearing surface of the lower denture by marking the heads with standard whiteout correction fluid or an indelible pencil, or paint in a thin soft wash as a temporary lining to reveal the location of the implant heads. Then use an acrylic burr to excavate a substantial 5 or 6 millimeter relief opening of all locations inside the denture where the abutment heads will reside. Test the denture intraorally to confirm seating of the denture while biting unhampered in maximum intercuspation. Lubricate abutment heads lightly with Vaseline. Place an elastomeric shim, which acts as a spacer, over the cervical half of the abutment, while permitting the O-ball half of the abutment to protrude uncovered, ready to receive the O-ring or nylon mini attachments. Note that the keeper caps with rubber O-rings or nylon plastic mini attachments are placed over the O-ball implant head until they are fully seated and tested for easy rotational movements. Next, place the lower denture over the assembly to verify that clearance is totally passive. If used, remove, wash, then dry the lower denture and fill its holes with pink, fast-set cold cure acrylic resin mix. Allow it to slightly polymerize to avoid running. Elastomeric shims must be in place at this stage to avoid acrylic locking onto the base of the abutments. Place the denture over the attachments. Then have the patient close gently but not firmly into replicable centric occlusion and maintain a closed bite. Allow full curing to a hard set. Then remove, clean, trim flash, and fill in any acrylic voids that may exist around keeper caps. Next, observe and correct any dental instabilities that might exist by performing an immediate chairside reline, soft or hard. Remember, always use elastomeric shims over the base of the O-ball abutments when using hard acrylic reline material to avoid implant lock-ons. Finish the overdenture borders. Remove flash material, then polish to a high luster. Finally, replace overdentures intraorally and perform a final occlusal checkup. Have the patient practice insertion removal procedures until he or she is comfortable with the technique. IMTEC Corporation's Sendax Mini Dental Implant System clearly represents an enormous breakthrough for your patients who might otherwise not be able to take advantage of recent advances in the field of implant dentistry. The system is available in standard and O-ball abutment head configurations. Both may be purchased in thread lengths of 13, 15, and 18 millimeters to accommodate varying bone heights. 2 IMTEC mini implant kits, one partial and one complete, round out the system and provide for all the surgical and prosthetic instrumentation necessary to add the system to your dental implant practice. You'll soon realize why clinicians around the world are rapidly gaining the appreciation and gratitude of their patients with this small wonder.